Let's talk libido, ladies. Have you noticed that yours has started to decrease as you've gotten older, as you've gotten busier, after you had kids, maybe as you've been with your partner longer, or after you went through menopause? Then join the club. You are one of many, many women who've noticed a change to their desire for sexual intimacy with their partner. There's nothing wrong with you, but if this is something that you want to change in your life, then this video is for you. My name is Galloway. I'm a certified nurse midwife with over 12 years of experience in women's health. In this video, we're going to talk about the changes that happen to our minds and our bodies that can decrease our desire for sexual intimacy or our ability to orgasm over time. We'll talk about the hormones involved, and we'll also talk about some simple solutions for improving your libido. Libido is different for everyone. Some women have an overabundance, and a lot of women have a little bit less than what they would consider to be normal. But there is no normal. Only what's normal for you. Today, we're going to talk about when your normal becomes abnormal, specifically when it becomes less over time. Over the years, I have had a lot of women come into my office and ask for hormone testing because they've noticed a significant drop-off in their libido. The three most common times in women's life that I find that they notice a significant decrease in libido is after having a baby, specifically in the breastfeeding and postpartum period, when they're going through perimenopause, and in the postmenopausal era. These timeframes in women's lives are when women are going through significant hormonal changes, specifically a lack or decrease in the amount of estrogen. And the lack of estrogen can lead to a decrease in our libido and also a decrease in vaginal lubrication. In the postpartum period, specifically for women who are breastfeeding, it's a very high progesterone state and low estrogen state. In the perimenopause era, our estrogen levels are fluctuating a lot more than normal throughout the day. And so we can have some really big valleys where we're not getting as much estrogen as we once were. And then in the postmenopausal era, we're really not producing much estrogen at all. Testosterone levels also decrease with age, and women in their 40s and 50s have significantly less testosterone than women in their 20s and 30s. Testosterone is huge when it comes to libido. It really increases blood flow to our erogenous zones like our clitoris and our nipples. It also increases our desire for sexual intimacy. Knowing about these hormonal changes helps us to figure out why libido may start to decrease as we age or as we go through certain periods of life. I don't need to test your hormones to tell you why your libido is lower when you're postpartum, when you're perimenopausal, or when you're postmenopausal. That doesn't mean there aren't hormone tests out there, and your healthcare provider may want to test those for you in order to treat you. Unfortunately, just giving you a prescription for hormones may not treat the root cause of your low libido. There are many women who experience low libido who are not in those three big phases of life. So if you're not in one of those big three phases, then why is low libido happening to you? For many women, libido is a multifaceted animal, and it's not as easy as just hormone changes, although our testosterone levels are significantly less than men, which is why many women struggle with libido more than men do. As I mentioned earlier in this video, I have a lot of women who come into my office and ask me why their libido is lower. And for most of them, I'm going to try to get to the root cause, especially if those women are in their 20s and 30s when their testosterone levels are still relatively high. When I try to get to the root cause of low libido, I ask a lot of questions. I ask, what medications are you taking? What supplements are you taking? How is your relationship with your partner? Has anything changed recently? What's your stress level like? Has it increased? Have you made time for self-care recently? What are you doing with your partner to spend time together? Are you going on date nights? Are you engaging in foreplay? Are you exercising regularly? How do you feel about your body? Has anything changed that makes you feel worse about the way you look? Are you experiencing pain with intercourse? Are you experiencing vaginal dryness? Do you feel safe in your relationship? And have you ever experienced any form of emotional, sexual, or physical trauma. These are just a few things that can significantly affect women's libido on a day-to-day basis. And it's a pretty long list, but it's not exhaustive. Are any light bulbs going off in your brain? Are you wondering, are things in your life affecting your libido? I had a patient in her mid-20s who came in to talk to me about her libido recently. She and her partner had been together for a couple of years. They'd always had a good sexual relationship. And then all of a sudden, her libido tanked and she couldn't figure out why. And so I started asking her some questions because in your 20s, you still have plenty of testosterone, and the abrupt change in her libido made me think there might be something else going on. So when I went through that list of questions, I finally got to the end and we started talking about trauma. As it turns out, she'd had a miscarriage about a year prior, and the miscarriage was really traumatizing for her. She felt poked and prodded in the hospital, and it really impacted her relationship with her own body. Now, it hadn't seemed to affect a relationship sexually with her partner, so she really didn't connect the two. But then her stress level started increasing with her job and other things in her life, and that's when she came in to talk to me. And we realized that the stress in her life was actually increasing the trauma experience from her prior miscarriage. And so we talked about therapy, and she went and worked through her trauma with a therapist, came back to see me 6 months later and said she had been fixed. Her libido was back to what it was. And what we needed to do was get to the root cause of her low libido, because she came in thinking, well, it must be just my hormones are off. This is just one patient's story. I would love it if any of you wanted to leave a comment down below to tell me your story about how you might have noticed something that affected your libido in the past and how you went about changing it. There are so many women out there who struggle with libido, and a lot of them are just hoping for a quick fix, but the reality is it's not often that easy. It's multifaceted, and we usually have to get to the root cause. Let's go through our list and talk about some of the solutions you can use in your own life to increase your libido. Number one, let's take a look at your medications and supplements. Are there things that could be affecting your mood, could be affecting your libido, or could be affecting your ability to orgasm? Especially those of you who are on mood meds, you may want to take a look at these. And if you think they could be affecting it, you can always talk to your provider about potentially changing dose or type of medication. Number two, let's take a look at your relationship. How's it been going lately? Have you been spending time with each other? And does that time include things that are other than just talking about your day, your kids, your to-do list? Are you making space for each other physically, emotionally, spiritually? Are you having fun together? If you're not making time for your partner, the reality is you're probably not feeling very romantic toward them. And for us women, most of the time we need to feel a little bit of romance in order for our libido to be where we want it to be. Number three, take a look at your stressors. Have you been more stressed recently? Have you been coping as well with that stress as you normally have? What are you doing to take care of yourself on a daily basis? And if you're more stressed than normal, how can you work through that stress? Things like yoga, meditation, practicing gratitude, all kinds of things out there can help us decrease our stress levels. But if your stress is elevated and you're not coping well, it's likely going to impact your libido. Number four, take a look at your sexual practices. Are you engaging in foreplay? Most women need some sort of warm-up to lubricate the vagina and help them to achieve orgasm. So if you and your partner are not taking the time you need to actually engage in meaningful and pleasurable sexual experiences, the likelihood of you wanting to have sex in the future is not quite as high. Number five, speaking of vaginal lubrication, are you noticing that your vagina is not as lubricated as it once was? You may be in the postpartum period, you may be perimenopausal, postmenopausal, and you may need some extra help. I think a good lubricant goes a long way. And if you want something more than a lubricant, you can always talk to your healthcare provider about a little bit of vaginal estrogen. That can really increase lubrication and help us to enjoy sex more. Number six, are you experiencing pain with intercourse? It doesn't have to come from vaginal dryness. Some women experience pain from intercourse for other reasons. It could be vaginal or pelvic pain, or it could be pain in other parts of your body. in general, if you're having pain when you're having sex, you're not enjoying it as much. And that can lead us to not want to have as much sex in the future. So if you're having vaginal pain or pelvic pain, I'd encourage you to talk to your healthcare provider about going to a pelvic floor physical therapist. These physical therapists are called magicians in my book for a reason. They are magical when it comes to helping women get rid of some of that pesky pelvic and vaginal pain. And if you're having pain in other parts of your body, maybe you need to go to physical therapy just to help with your shoulder or something else that might be hurting. Either way, if you can decrease pain, you're likely to increase your desire for intercourse. Number 7, how is your relationship with your body? Have you noticed that your body has changed in a way that you really don't like as much? Maybe it doesn't look the same after you had a baby. Maybe you've gained some weight recently. Maybe you're aging and you don't like the way your skin looks. Whatever it is, if you're not feeling sexy in your own skin, you're not as likely to feel sexy when you're having sexual relationship with your partner. So what do you need to do to improve your body image? Do you need to exercise more? Do you need to get that boob job you've always been thinking about? Mommy makeover? Do you need to go to therapy? Do you need to just have acceptance about how your body has changed and the fact that you still feel good about the way your body looks? Whatever it is, I encourage you to do the thing that helps you to like the way you look so that you can feel sexy and therefore increase your sexual relationship with your partner. And my guess is your partner probably thinks you feel sexy anyways. It's probably just in your own head that you don't like the way you look. Number 8, speaking of exercise, if you haven't been exercising recently, get after it. Exercise increases all those good hormones. It helps us feel better in our body. It helps us have more energy. It helps our mood. And it helps with blood flow, which encourages our bodies to be able to orgasm more and helps us to reduce the risk of all those injuries and cardiovascular disease and things like that that can significantly impact our libido and sexual relationships in the future. So if you're not exercising, you should think about starting. Lastly, number 9 and number 10 are both about trauma. And if you've ever experienced trauma in your life, whatever it might be, physical, emotional, sexual, you probably have noticed that it impacts you at different ways at different times. Many women who've experienced trauma go on to have great sexual relationships with their partners. And there are also women who feel like it really impacts their sexual relationship with their partner. Whatever kind of trauma you may have experienced in your life, I encourage you to work through the trauma, because if you haven't worked through that trauma, it's likely going to impact your relationship with yourself and your sexual relationship with your partner. Ultimately, if you are experiencing low libido, I encourage you to explore all the things that we've talked about today to see if there's something in your life that's affecting the way you feel about your sexual relationship with your partner. You may have some work to do, but if you do the work, the reality is you're likely going to notice an increase in your libido, which is what we're all after, right? And maybe consider therapy. Talk therapy, physical therapy, pelvic floor physical therapy, sex therapy. There are all kinds of therapists out there that can help us to increase the way that we feel about ourselves and our bodies so that our libido can increase. For those of you wanting a quick fix, sorry I couldn't give it to you today. You could talk to your healthcare provider about replacing estrogen and testosterone because these sometimes can improve women's libidos. There are also a couple medications out there on the market that are for women who truly have the diagnosis of hypoactive sexual desire disorder. However, most of those are not very well covered by insurance, and they're only for a very specific patient population. There are also a lot of supplements out there. I'm not familiar with a lot of them, but there's all kinds of stuff that says that they can increase your libido, increase your ability to orgasm. And so if you've tried them, I'd love to hear from you. Please leave your experience in the comments so that you can maybe help other women who are like you, who are looking for a way to help improve their libido. There are other resources out there as well. I love the book Come As You Are by Emily Nagoski. She gives women a play-by-play on their bodies and their libidos that I think is super intellectual and refreshing. There's also a podcast called Sex with Emily that I like. There's a website called OMG Yes. And then there's this app called Rosie, and it gives you little excerpts of erotica that a lot of women find helpful in kind of getting in the mood. If you have questions about libido, if you have a story you'd like to share, or you have anything else you'd like to talk about, please mention it in the comments. And if you want to learn more about some of the subjects we've talked about in this video, make sure to check out this video on perimenopause. Stay healthy, everybody.